We know from some very preliminary data that we can identify these MET exon 14 skipping mutations. They happen in about 4% of patients with lung cancer. That's about as frequent as ALK. And we also know that there are some drugs that have shown significant tumor shrinkage for patients with these MET exon 14 skipping mutations. Now, MET exon 14 skipping mutations are not routinely identified in standard assays, but there are next generation sequencing tests that do identify these mutations, and many patients are having those every day today. And so when we look at those results, we may learn that we can go further for these patients beyond EGFR and ALK and maybe identify new targets for those patients and identify trials today and hopefully standard therapies in the future. For MET exon 14 skip mutations, we need a MET inhibitor, and we know that a number of MET inhibitors were studied in big trials, including antibodies as well as small molecules, but probably the best MET inhibitor is one we don't even think of as a MET inhibitor, and that's crizotinib, which is thought of as an ALK inhibitor. It was originally designed as a MET inhibitor, and the drug actually works well as a MET inhibitor. So some of the earliest data for MET exon 14 skip mutations is with crizotinib. There are other MET inhibitors available, so cabozantinib also has the ability to inhibit MET, and there are other new MET inhibitors in development.